So let's see. So Dr. Jennifer Welch, so she's Dean of Admissions at Upstate University, my alma mater. So today she'll talk about annual pre-admission workshop for Native students who are interested in healthcare professions. Jen, thanks for being here.
Great. Thank you so much for having me. Okay, so now let me share my screen. All right, can we see that? It's probably at the end. It shouldn't be. All right, let's see. 1 second. Oops. Oops, sorry. We'll go quick here. All right, thank you so much. And thanks so much for having us here today. I wish that my colleagues, Dr. Brian Thompson, Dr. Crystal Ripa could be here, but Crystal is in Myrtle Beach on vacation, and we certainly didn't want to interrupt that. And Dr. Thompson has been delivering babies right and left. So I don't know if COVID had a really big impact on that, but I think that it did. So I appreciate being here. And I wanted to talk a little bit about, you know, the PAW program and what we've done at SUNY Upstate to really grow our Native group of students. So let me give you a little bit of an idea about Upstate Medical University. It is an academic medical center. We service 21 different counties from Canada all the way down to Pennsylvania. We are an upper division transfer institution, and we offer bachelor's degrees, master's degrees, PhDs, doctorates, doctorate in physical therapy, MD, for the health professions. We have about 1,600 students in 4 different colleges: College of Medicine, College of Nursing, College of Health Professions, and College of Graduate Studies. And I, at this point, oversee all of the admissions to all of those programs. So this, when we first started the PAW program, it was really about getting Native students interested in one of our health professions. So the other thing is that Upstate is located on Haudenosaunee land. And so that was really, really important to us. So let's see, just wanted to share this. There's never been a better time to bridge the cultural divide and remind ourselves of the social accountability we have as academic medical institutions to society. All right. Okay, so the why. I'm sure that, you know, maybe you guys have heard some of these numbers today, but I did want to share them again. There's a tremendous crisis in the US regarding the statistics for Natives. The Native American population die much younger, about 25%. Deaths occur before the age of 45, compared with 15% of Black or African American and 7% of white deaths. Increased Native health professionals to serve Native county or Native reservations can attribute to minimized health disparities. There's a 30% vacancy rate of providers within the IHS, and there is no IHS facility in New York City, with 1,100, no, I can't even talk today, 112 Native population. Okay, so there's more here. And I found this top point very disturbing. Of the 20,921 medical school graduates in 2021, only 35 of those identified as Native. There's only 10 out of 37,000 full professors in medicine that are Native. And you can really see these numbers are just astronomical. Only 11% of the MD granting institutions have Native content in the curriculum. 40% of Native students in medicine are spread among 6 medical schools in the mid to southwest US, and 90% of the US medical schools have 3 or fewer Native students. And that has been true for Upstate Medical University as well. So how it started, that's Dr. Brian Thompson on the left-hand side. He is a clinical assistant professor in OBGYN. He's an Upstate grad, and he's a member of the Oneida Wolf Clan in New York, which is right very, very close to us. Myself, I serve as the Dean of Admissions, and then Dr. Crystal Ripa serves as the Special Program Director on our campus. So probably late 2017, early 2018, Dr. Thompson and I started talking about initiatives and trying to increase the number of Native students on our campus. And, he told me about this PAW program. It was going to be at the University of Arizona, Phoenix in the spring of 2018. And I thought, well, you know what, let me go and check it out and see, if it's anything that we could maybe see ourselves doing. And I got out there and I was absolutely overwhelmed, not only with the stories of the participants, but the stories of the physicians, of the access issues that I learned about at that event. And it was probably one of the most moving experiences I've had in the 29 years actually that I've been doing admissions work. And so I came back to Upstate and I said, okay, let's make this work. And we're going to do this for October. So this was, I think, April timeframe. And I said, we're going to do this for October of 2018. So I went to the leadership and I just heard the last speaker talking about getting buy-in from the leadership, absolutely key to making these programs work. So went to the leadership with Dr. Thompson. We talked it through. We talked about what we were going to do. We reached out to AAIP, and I'll talk about that in just a second. And we decided that we were going to make it happen. So with that, I mentioned reaching out to AAIP. They have these longstanding partnerships with the Four Corners Alliance, which was the event that I attended at the University of Arizona, Phoenix. There also was another PAW that was starting at the University of Minnesota, Duluth, and we were going to be the first school in the New England area, Northeast region of the country, to do something like this. I understand from Dr. Thompson that there had been something at Harvard years and years and years ago, but we decided that it was time to kind of reinvigorate whatever it was that we could to get Native students into the pipeline. So we started the PAW program, and it really does, it brings students together with physicians, with AIP physicians, with other students, with public health professionals, with admissions professionals, and other folks who are really interested in getting these students the information and helping them to obtain the skills that are necessary to be successful in medicine and or another health profession. We have had several students that have come through that are interested in nursing or PhD or PA or physical therapy, as well as medicine. So we've really tried to encourage those students to keep going. And we're going to be hosting our 5th PAW this fall. So I'm just delighted in that. It has been a lot of work. Dr. Ripa is the program director of the PAW program at our institution, but it has really been very, very successful. So, you know, when I came back and we had 3 or 4 months to make this happen, we made it happen. And there are days I wonder how we did that, but we ended up having 20 Native students that applied for the program. 14 of them were women. They came from 12 different undergraduate institutions, 8 different states, 9 different tribal nations, and they were both non-traditional and traditional students. I would say that at every PAW that we've had at least a couple of students that have families or children or significant others that they're managing, and they're going through this process as well. So during the Upstate PAW of 2018, we also included 3 additional schools. We felt that not only was this important for Upstate Medical University, but it was also very important for other schools in our region because of the Native populations across New York State. So we included Albany Medical College, the University of Rochester, and the University of Buffalo. Every student had a series of post-PAW individual advisements, and we continue that to this day. Many of the students that were in the pipeline, some of them were actually active in the application cycle for that year, and actually one of them ended up getting accepted into Tulane. So that was a really great honor for us, and also wonderful, wonderful accomplishment for him. I think one of the most special parts about the PAW event, though, was the cultural components that Dr. Thompson was able to have us and all of the students participate in. There was a night of Native dancing on campus, and then we also visited the Oneida Nation for a traditional Native dinner, as well as an evening at the Longhouse. It was spectacular. So as for the sessions that we included in the very first PAW, it was, we did mock interviews with MMI prep, as well as traditional interview prep. So we ran the students through both MMI and traditional interviews. We also did an Ask the Deans session where the College of Health Professions Dean, the College of Graduate Studies Dean, and then myself answered any questions that the students had. We did a mini college fair. We also had presentations from the AAMC on completing the applications, financial literacy. We did personal statement writing, academic support, and how to ask for it and when to ask for it. And then we did a student and physician panel. In 2019, we actually increased the number of students from 20 to 26. That was a little bit of a financial significant cost, but we felt that it was very important that we get students on our campus. So 22 of them were women, 14 from 14 different undergraduate institutions, 9 different states, 9 different tribal nations. And again, we saw the same type of student where there were traditional students that were, in undergrad, and then there were students that had graduated and were now thinking about the next step. We only had 2 medical schools participating at that time. Unfortunately, Buffalo was going through some transition and were not able to be part of it with us, but the University of Rochester and Albany Medical College participated. And then we also had a current Native medical student from Mount Sinai who came and discussed the AMS chapter, which Dr. Bazinski was really the catalyst that started that campus, or that chapter on our campus. And I'll talk again about that in just a moment. But we did some new features at the PAW 2019. We did shadowing, we did true confessions of the deans. We did a My Fears session. One of the things that came out from the 2018 is that a lot of these students were really worried about imposter syndrome and whether or not they could really be successful in medicine. So we did a My Fears session. It was wonderfully received by the students. We did a Maximize Your Application, kind of a behind the scenes. I've chaired the College of Medicine Admissions Committee since 2006. So we talked a lot about things that really I've seen in the process that can kind of make or break an application. We did a mentorship and organizational skills workshop, and then we also did IHS scholarship and repayment session. And then, so in between 2019 and 2020, we created our own AMS Student Organization. And like I said, Dr. Bazinski was the one who was really instrumental, he and Dr. Ripa, in getting that off the ground for us. And AMS really aligns and partners very, very closely with AAIP. Right. So then moving on to 2020 and 2021. We ended up not doing a on-campus PAW in 2020, right smack dab in the middle of the pandemic. So we ended up hosting a virtual session in January of 2021, and then we did another session in October of 2021. And you can see by these numbers that we were able to exponentially increase the number of students that were able to come. 39 in January and 30 students in October. We had all of the same schools that had participated in the first PAW with us. And in 2020, oh gosh, I didn't even write that right. 2022, the PAW will be in person, and it will also incorporate all of the cultural events that we truly have missed. So the virtual PAWs, we did the addressing fears again, since that was so well received by the students. We did a belonging discussion and finding an institution or a place where you really felt that you could be a part of. We did a health professions panel, we did a college fair, we did mock interviewing. IHS did, again, an all about the money kind of event in conjunction with our financial aid office, who talk a lot about financial literacy. And we did a student panel, and then Dr. Bazinski did an ANAMS, mentorship connections, where he put students with prospective students. So that was really well done. This is a picture of one of our groups. Always fun to see them. They were so delightful. And then this is Dr. Thompson there in the middle. And like I said, I wish that he could be here. The picture on the bottom is actually the native dancing that the natives were doing on campus. It was fantastic. And then the others are some of the mini college fair sessions that we did. And I think over there on the right bottom is our president doing a welcome to the students as well. The Paw Feedback was amazing. I mean, you know, going to the first one in Arizona and then doing our own and listening to the feedback at the end of the session, because, you know, Dr. Thompson really wanted to get feedback from the students on what we could do differently and what we did well. And I remember leaving both the 2018 and the 2019 PAW sessions in tears. The students were so thankful for the experience. They were so thankful for the guidance. You know, their stories were hard sometimes to listen to, but just being a part of their day, well, their 3 days with us was just fantastic. And we got to know them on such a wonderful level. But, you know, here's some of the feedback that they provided. It gave them an opportunity to ask questions. They liked the mock interviews because it was one of their biggest worries. They're not good at interviews. And what we did during those mock interviews was not only did we interview them, but we also provided them on feedback as to, you know, what they could do differently, what they did really well, what they might want to work on, that kind of thing. We had a wonderful keynote speaker for every one of the PAWs that we've held. Student panel helped them to realize that, you know, I remember one of the students was talking about how he's really struggled with getting to this point. And he just graduated a couple of years ago and he's doing fantastically. And it's just really nice for the students to hear that just because you got a C maybe in organic chemistry, that you could still be a doctor. And then also, I think that the favorite for everybody was the event that was hosted by the United Nations. The food, the celebration, the overall hospitality was a great example of the community and culture that I could experience if I attended Upstate. So that's, I think, what we've missed over the last couple of years with everything being virtual. And like I said, we absolutely cannot wait to get back to that. So in addition to hosting the PAWs, we've also done continuous advising for these students. So, you know, I probably should say that differently. Crystal Ripa does advisements for students, and she does a lot of these monthly meetings with students. And then we also do these 1-hour webinars 3 times a year, focusing on different aspects of the application or interviews or letter of recommendation requests or something like that. We also have been really trying to develop some partnerships with Syracuse University's Haudenosaunee Promise program. So right now we have a couple of positions that are carved out in we have a BSMD program with Syracuse University. So a couple of the positions or the spots, I guess, that we have are for students that are in the Promise program. And then we also are working on pathways for Native students to go potentially from their high school, Lafayette, the United Nations School, wherever they might be, to OCC, which is our local community college, then potentially to Syracuse University, and then on to Upstate Medical University for whatever field of study that they're interested in. So the biggest challenges, limited mentorship and role models. I think that we've really struggled with that. And I feel like sometimes, you know, Dr. Thompson is that person for us, and he's just one person. We need more. This past year, we were able to include Trina Skeel, who is part of staff at the hospital and a nursing background, and she has been amazing. But we need more than just 2. We really need a critical mass of folks that are interested in helping to guide these students moving forward. And then sometimes we do find that the work-life cultural balance that a lot of these students are facing does take a toll on their academics. So trying to help them to find the study skills and the support that's necessary for them to be successful. And then also the role of standardized tests. We struggle with that, we really do. But also realize that medicine is a lot of standardized testing, and we don't feel good, you know, having students come in that you know, struggle with standardized tests, and then knowing that medical school is going to, you know, put those tests in front of them. So that is something that I think that there's a lot of us that would like to see maybe not be part of this, but unfortunately it is right now. So really teaching the students how to take these tests is really, you know, kind of where we're at. And then also having a culturally competent curriculum. and lack of STEM exposure, resource and financial investment. And I remember after our first PAW event in 2018, and I was at a faculty meeting, or I think I was doing a presentation on the PAW program. And everybody said, well, how many more Native students did we matriculate this year? I was like, it takes a while. This isn't something that we're going to be able to do in 1 year. It's going to take some time. And I will tell you that we are seeing the results. We're seeing the fruits of our labor, if you will. We have a student applying into our nursing program that went through PAW. We have another student that's applying through the PA program that went through PAW. We also have one that is in our medical school process right now. So we are seeing the outcomes. They just take a little bit longer than a year. So future planning, there are certainly things that we're hoping to make happen. Application fee waivers, in-state tuition for all Native students. That's a biggie. Looking at affiliations with tribal colleges to get more of their students to our institution. We're working very hard on the developing pipeline and early exposure programs. And then the recruitment and retention of Native students and faculty, huge. But we really need help in getting there. And we've also solicited the AOA Honor Society to help with Native mentoring. So there's a lot there, but I think that the biggest one has been our PAW program. We love it. As the presenter before me talked, it is expensive. I believe that the first year that we did it, it cost us about $25,000 for just 20 students. Because we do fly them here, we house them, we feed them. But then, when the numbers trickled up a little bit, it was about 30-something thousand. And now that we've got, between 30 and 39 students that are attending our virtual sessions, I'm a little anxious about that. I think that maybe, there were more numbers because things were virtual and people didn't have to give up the time or, getting off from work or getting off from school to attend. But I do think that there's something to be said about being on the campus and really having that opportunity to get to know each other as well. So I don't know where we'll end up for this October, but I can tell you that we are incredibly excited about it and are excited to really move the program forward to the next level.
Dr. Welch, thank you so much for that.
You're very
excellent overview
welcome.
of the program. We have some questions here. So one, I just want to ask about, so it seems like, we can compare and contrast the Four Directions program and then the PAW program at Upstate. And I think that one of the nice things about the PAW program at Upstate is that it has a lot of collaboration between multiple institutions, especially AAIP and then multiple medical schools. So can you just talk about how students benefit from kind of getting multiple perspectives?
Yeah, and I think that that's a really great point, Cameron, that you bring up is, when we first started talking about it, we were, first we were like, okay, can we afford something like this, right? And us being a state University of New York, we were kind of like, well, maybe if we get some partners, maybe it will, help us. But we ended up just moving forward on our own and just including our partners at Rochester and Albany and Buffalo. And we really felt that Upstate might not be the right place for everyone, but perhaps one of these other institutions would be. And so that was more important to us than matriculating these students just at Upstate. It was giving them other options, and maybe they connect, or maybe maybe Buffalo has something different than Upstate does, or Albany or whatever, but we really wanted the students to have other options. And the admissions deans at each of those institutions also, I think, were very thankful. I can tell you that application numbers at each of those institutions has increased from Native students, and that's ultimately what we wanted to do. And then I also understand that Native matriculants has also increased at every one of those institutions. So that was the impetus for all this. It was not necessarily matriculating the students just at Upstate, but getting more physicians in the door, or getting more medical students in the door to become physicians. And I think that it's really served all 4 of our institutions very well.
Right. And then also another thing I wanted you to comment on is a utility of post-bac programs. So I feel like there are a lot of students that are almost ready to go to medical school, but not quite there. So can you talk about, you know, the benefit that students have from going to post-bac programs?
Yeah, so I think it depends on the student, but I do think that, you know, either a post-bac or a master's degree in something, you know, especially if we do see students that have academic promise, but may not have a strong science background. We have agreements with the Buffalo Post-Bac program, which is funded through AMSNY, which is a federally funded program. And we've had such incredible success with that program. Students go, the program is designed specifically for them with regard to, you know, if they need more help in chemistry, or they need more help in biology or anatomy and physiology, whatever it might be, where the student may have potentially an area that they need to strengthen prior to coming into med school. We've had really wonderful luck with that. The nice thing too about that program is that it's fully funded, and the student receives a stipend to attend the program. So that's been wonderful. And then we also have our own master's degree program where we can, it's a 1-year program where we can identify students at the admissions process who are not, again, quite ready for medical school, but we want to see that they have strengthened their science acumen especially. And so we've sent them through our medical technology master's program. And again, that has been a wonderful pathway program for us. So, you know, we do look at applicants very holistically. I'm sure that you sensed my hesitation with the MCAT. We struggle with that. But we do want students to obviously come to our medical school, PA school, whatever it might be, and be ready to be successful. So these programs have really served us very well.
Right. And then one last question. I also asked this question of Tina, but how are you making sure that communities that may not know about, you know, Upstate in this program, that they're kind of finding out about this and can potentially benefit from it?
Yeah, so a lot of what we've done is through AAIP. You know, we have also reached out to the institutions where we're seeing a lot of these students coming from. We're reaching out to you know, tribal colleges to really show them that we're here and this is successful, and then certainly through the students themselves. I think that they really have enjoyed the opportunity to get to know us and one another, and that in and of itself, you know, with social media has I think really served us well. You know, Crystal, who is the director of this program, she's fantastic. I don't think that she sleeps ever, but she's constantly thinking up new things and new marketing and new ways to attract students. And, you know, she attends the AAIP annual meetings and things like that. So, you know, really being present and really being available has really, I think, made the difference.
Yeah. Well, Dr. Welch, thank you so much for being here. We appreciate all the work that you do.
Absolutely. Thanks for having me, Cameron.
Yeah, thank you.
Thank you, everybody.